Will thank you. All right. Well, it is 7 o'clock, and we want to say thank you for joining us and participating in our 4-session Jeopardy with a COVID spin. We are excited, and we expect more people to sign in. So let us at least thank those who are here for being here and acknowledge that Miss Darlene gets the bonus points for tonight because she was the first one to sign in. But beware. Wanda Walker said she been practicing and she is ready. But the mayor said, fear not. She is holding down Orville and she gonna scoop the points. And so, so look out. You have 2 bonus opportunities, 2 bonus columns this time, but we'll share that with you in a minute. Now, let's look at our leaderboard for tonight. Dr. Ford, if you will pull up your leaderboard and let's see how we're looking tonight.
Good evening, everyone. Let me get the leaderboard on the screen. Give me just a moment here. All right. And we have first place, Mayor Lumpkin.
It's not quite on yet.
It's not on? Okay, let me stop sharing. Let me reshare it.
But we did hear Mayor Lumpkin was #1. She already grinning.
Yeah, we're starting off tonight with Mayor Lumpkin in place.
Okay, let's see if it's going to share.
Okay, is it showing now? It's not? Okay.
It's trying. It's probably just delayed.
Okay. Let me share.
We'll give it a chance. Probably have to just give it a chance.
Okay. I won't click off of it.
You want to go on and read your scores from the leaderboard though?
Okay, I sure do. I will. #1, Mayor Lumpkin. In second place, we have Miss Stephanie Brand. In third place, Dr. Crenshaw. Fourth place, Miss Evelyn Hudson. Fifth place, Miss Wanda Walker. Sixth place, Judge Gilles Petway. Seventh place, Miss Shaniqua. Eighth place, Miss Julia McKinney. Ninth place, Selma Stewart Center. And 10th place, Miss Darlene Davis.
Oh, that's why Darlene is on first, because she got to add some points. So she gets an extra 100 points just for being the first one in tonight. All right, Mayor. You see you on top. Now we look.
Yeah.
They coming after you like sharks tonight. So get ready, get ready, get ready. All right, let's see. The our guests have not signed in yet, but we hope that they will join us. But tonight, you have within our chapter of Gamma Alpha Zeta, the Dallas County Zetas, we have nurses within our membership. So we have Ms. Karen Bailey, we have Dr. Shalisa Ford, we have Dr. Ellen Buckner, and we have Dr. Constance Hendricks. So we are serving as part of the expert panel tonight to share your nuggets as we go through our game tonight. All right. And Miss Karen, if you are ready to pull up. Oh, before you do that, well, while you're pulling it up, Karen, go ahead. And Dr. Ford, run through that leaderboard one more time so we can hear those names so they know how they got to fight now to get these points. I'm glad they're not in person because they can't do no physical fight. They just have to jump out at these points.
Are you all able to hear me? Because I'm not sure what's going on with the internet, but I'm actually on my phone and the computer. Can you hear me?
We can hear you, yeah.
Okay. So in first place, Mayor Lumpkin, followed by Mrs. Stephanie Brand in second place, Dr. Crenshaw in third place, Ms. Evelyn Hudson in fourth place. I'm sorry, did you tell me say the points, or you just want the
Well,
order?
well, you might want. They might want to know how many points they got because it's cumulative.
Yes, ma'am. Mayor Lumpkin in first place with 2,100 points.
Oh,
Miss Stephanie Brand, second place, 2,050 points. Really close.
ooh,
Dr. Crenshaw, 1,500 points.
wow.
Miss Evelyn Hudson, 1,000 points.
Uh-oh.
Miss Wonder Walker, 700 points.
Watch out now. She coming at you. She been
Judge,
practicing.
Judge Petway, 600 points. Followed by Miss Shaniqua and Miss Julia, they tie with 500 points apiece. Selma Student Center and Miss Darlene Davis, 200 points.
Okay, Miss Darlene got 200. Watch out, y'all. You know she thinking today because she came on early. She is ready. All right, and I would encourage you to go on and text your friends who were here last time and remind them that we are on and they're about to miss out. Karen, are you ready to pull it up?
Here we go. Can you hear me?
Yes, we can hear you and we can see the board. All right, ladies. Stephanie's coming in now. She's ready. She's coming on in here. All right. Let's see. Who will go first for the first category?
I would go first.
Oh, shucks now. Come on, Mayor.
Let's go with I don't feel well.
Okay.
$300.
$300.
Testing positive for COVID-19 requires doing this and staying away from work and public places for at least 5 days to prevent the spread of infection.
What about isolating yourself? Quarantine yourself for 5 days?
Okay.
And actually, you bring up a good point, Mayor Lumpkin. The CDC has clarified the differences between quarantine and isolation, and this falls in the category of isolation, actually. So
we're gonna give her credit for what it says, quarantine. And there's another question, but we'll keep clarifying the difference.
Yeah.
All right. Mayor Ford has the board. Mayor Lumpkin has the board. Do you want to keep it or you want to give somebody else a chance? Mayor?
I like hot off the press for $500.
Oh, she's going for the gusto. And that whole column is a double jeopardy.
This is a constant presence in a community. It differs from a pandemic because the virus is somewhat contained and not spreading out of control.
Now, Dr. Hendrick, I have a team player. Can I ask Deborah Lumpkin to answer that for me?
You may, yes.
Deborah Lumpkin.
Okay, hold on one second. How long do I have? Give me
You got a minute. You got a
okay.
minute.
It's a constant presence in community. Pandemic.
Hot off the press. If y'all been listening to the news, they've been talking about. What's the word? And remember, this is Jeopardy.
What is incubation?
No, not incubation. Anybody want to grab that?
Oh, Mayor Lumpkin, help me out.
Oh, I'll grab it. Oh, okay. We all right. You giving it? All right. Go for it, Dr. Hendricks. What is endemic?
Yes. What is endemic?
All right. This is your new word for the day.
Oh,
Write
yeah.
that down. Endemic.
Okay.
And endemic is when we can't get rid of the virus. It's not going to go completely away, and we're going to have to learn to live with it. It's called an endemic. And so as of yesterday, the CDC put out new guidelines that says that they are going to guide us as if this is an endemic instead of a pandemic. A pandemic comes, hits you, and you should be able to get rid of it. But it looks like this COVID doesn't want to go away. So endemic is your new word now. All right, you let the Zeta team swoop that one. Next. Dr. Henderson, you want to take it or you going to give them a chance?
Oh no, I'm gonna give them a chance.
All right. Who will take the next question? Hot off the press is bonus column.
I'll go.
All right, Miss Stephanie.
Let's see. Let's do 500. I don't feel well.
All right.
Common symptoms of COVID-19.
What is sore throat? What is coughing? What is sneezing? What is fever? What is loss of smell, taste, headache.
You did good. Hit it, Karen.
That was really good.
Yeah.
What are headache, fever, cough with or without chest congestion, shortness of breath, difficulty breathing, sore throat, runny nose, loss of smell, loss of taste, muscle aches, fatigue, nausea. That was really good.
Thank you.
And remember that we said when we had the first round of COVID, when that people had a loss of taste, loss of smell. But when Omicron came around, many people are not losing their sense of smell or taste, but they have many of these other symptoms. And so just because you still can smell and you can taste does not mean that you don't have COVID. And you may not have a fever. So now trying to screen, as we were doing initially, with a thermometer is really of no value because you may not have a fever and still be shedding the virus. And most of us on here may remember about the chicken pox. And if you remember with the chicken pox, you were shedding the virus before you broke out. And if you think about it that way, by the time you knew you had the chicken pox, then everybody you had been around, you had exposed them to it. The same way with COVID. You may be shedding and going around other people and not know that you are shedding unless you have a test. So if you think about that, that may help you with that. All right. Great job, Miss Stephanie. You get the first up. I'm pulling the next category.
Okay. Let's see. I don't feel well for 400. Let's finish this out.
We all need healthy lungs to breathe. COVID-19 in the lungs makes it difficult to get enough of this gas in your body.
What is oxygen?
Yes, what is oxygen?
All right. Miss Stephanie, you gonna give it up to somebody or you going again?
I'll let someone else pick, have a chance.
Dr. Hendrick, can I take mask and bag for $400?
You sure, baby? Come on, Miss Mask.
If I have at least 2 doses of the Pfizer or Moderna vaccine, what am I?
Vaccinated.
Remember, this is Jeopardy.
What is vaccinated?
Okay. And the
Fully
term
vaccinated.
is fully vaccinated. If you have 2 doses of Pfizer or Moderna, you are considered fully vaccinated. And then boosted means you've had your booster.
A lot of
When you're
people have only had one vaccine of the Moderna or Pfizer, but they're not considered fully vaccinated and they're still at risk of serious health conditions if they get the virus. So that's why it's important to make sure you have 2 doses of Moderna or Pfizer.
So, Nurse Karen,
Yes, ma'am.
if I get my shot today, am I covered today?
No. And the same is true with the flu vaccine. It takes 2 weeks in your body for you to be fully covered. So if you're vaccinated today, you're still at risk for 2 weeks. So you still want to protect yourself and those around you from exposure to the vaccine, because you could still get sick while you're waiting for your body to develop antibodies and provide you the coverage and protection you need.
Thank you. All right, next question. Who's going to take the next question?
I can take, what's that last card? Fully,
Max,
is it
Max and Vest. You want that for
Yeah.
500?
500?
Orville,
Roll the
come
dice.
on. Come on, Orville. That's a bonus. Double jeopardy.
Vaccines have the potential to be the equalizer of health disparities, especially around infectious diseases. I could never sleep at night if I developed anything, if any product of my science came out and it did not equally benefit the people that look like me, period.
I mean, am I
All
supposed to answer who is this? Who is this person?
Who is she?
Yes.
I can help her with
Dr.
that.
Dr. Kismikia Corbett.
Oh, look at Orville. All right, you all remember. It is so wonderful that we had a research scientist that looked like us that created our vaccine. So we want to take pride in the fact
That's right.
that she looks
That's
like
right.
us, and a pretty lady on top of that. All right. Watch your
Just
arms,
like
now
us.
They cutting up. They cutting up. All right, who's going next?
I don't feel well for 200.
All right.
Look at Deborah.
Let's see. Was that was Lumpkin?
It's Lumpkin, Dr. Kendrick, but it's my sister-in-law.
That's all right. That's the Orville team. Come on.
My daughter complained of a runny nose and extreme nausea before bed last night. This morning, she's running a fever.
What are symptoms of COVID-19?
All
Yes.
right. All right. Wonderful. Wonderful. All right. Orville, you want to pull the next one?
I guess I will. I don't feel well for $100.
Knock it on out.
I never get headaches, but I woke up with a headache and I cannot taste my coffee this morning.
What is symptom of COVID-19?
Yes. Again, 2 classic symptoms that people have complained about: headaches and loss of taste.
Yay. All right. All right. All right. Orville, you going to give somebody else a chance to call, or y'all going for it?
Yes. We'll give somebody else a chance, Dr. Henry.
It's an Orville thing, so y'all can come on, run the board now. You know, it's all good. Jackie has her light on. Jackie?
I want to, I guess, mask and vax for 200, please.
Okay.
3 things that can be done to lower the risk of COVID-19 for me, my family, and my community.
What is wearing a mask washing your hand, maintaining your space distance to 6 feet distance, and did I say washing your hand and sanitizing your hands?
Okay, yeah. Let's see the answer. Yeah.
Well, everything you said is accurate. The most important is to get vaccinated and boosted.
So you get half credit.
That's good enough for me.
Now, is that Orville or are you part of a team? I don't tell us.
Yes.
All
It's
of it.
Okay, all right. Watch Orville now. Watch Orville. Woohoo! She told me her team was coming. They here. All right. Sister Wanda, you wanna get one? She may have walked away with the grandbaby. All right. Who's gonna select again?
Dr. Hendrick,
Yeah.
that's a fat jack for $200.
Oh, 200. Okay.
In addition to vaccination, another defense against exposure to a respiratory virus is to wear this.
What is wear your mask?
Yes. Wear a face mask.
And for everyone that's not in Orville, you will be receiving your mail packages with all of your gifts, and it will include a KN95 mask. So you will get that package. So what we need you to do is, if you can handle putting things in the chat, we need you to give us your mailing address. If you will, and Dr. Ford will capture it, and we will be mailing out this weekend, but you know, snail mail, so look for it to arrive middle of next week for all persons other than Orville. All Orville gifts have been based in the mayor's office. And we have one more gift for you tonight, and we'll share it in a little bit. All right. Who's going next?
I'll go.
All right, Stephanie.
That's a fat jack for 500.
Oh, she on you, Orville. She trying to get you.
Antibiotics are effective in the treatment of bacterial infections, but not these types of infections.
Stephanie, you got it? Or are you giving it up?
What is viral?
All right. Yeah. All
Yes.
right.
So when if you have a doctor tell you he wants you to take an antiviral agent for coronavirus, it's different than an antibiotic. And there are very few antiviral agents right now available to treat coronavirus, to treat COVID-19. And it's changing every day based on how the virus is changing.
So what we just heard in the news yesterday from CDC is that very shortly, when you go to the pharmacies to be tested, if you test positive, there will be a new pill type medication that you will be able to get on the spot.
Dr. Hendricks, can I give a word of caution on the pill?
Yes.
The pill is supposed to be available, but the pill comes with some interactions with other medications that many of us commonly take, such as hypertension medications if you have high blood pressure, statins if you have high cholesterol. There's a long list. So before anyone takes one of those pills, I would just caution you to review the medications you're already taking with your doctor before you take the pill for the coronavirus.
Remember, one size doesn't fit everybody. One size fits most, not all. So everybody knows their own health status. So be cautious. Thank you, Karen. Who will go next? We have time for about 3 questions.
Can I go again?
Yeah, come on, Stephanie.
Let me get mask and vax for 300.
All right. That's a double bonus, so all right.
The type of Pfizer and Moderna COVID-19 vaccine. What type of vaccine are they?
It's double bonus question.
What is mRNA?
Yeah.
Yeah.
Yeah. All right. Remember, it's not a live virus. So don't let
No.
anybody tell you that. All right. Okay. Stephanie, are you gonna go again, or you gonna let somebody else try?
I'm gonna try
Dr.
one more time.
Oh, I'm about to knock you off, so you better speak up.
Yeah, I'm gonna come in, Stephanie.
Yes, ma'am. Let me do going viral for 500.
All right, that's not double bonus. That's just straight 500.
Through vaccination, a sufficient proportion of a population is immune to an infectious disease.
Stephanie?
What is herd immunity?
Yes, herd immunity.
Yeah. All right.
Hey, Dr.
What?
Hendricks, can I talk to that just for a second?
Just one second.
Early on in the pandemic, we were hearing that we needed to reach 80% herd immunity as a country through vaccination before we would start seeing the virus decline. And as a country, we're about 74, 76% right now. So we're getting close.
However, as a state,
As a
Alabama is where?
We are, as a state, actually, I don't know for the state.
Last time I looked, we were right at 65.
Yeah, and for Dallas County, fully vaccinated is about 47%.
So we are nowhere close to herd immunity.
Not in Dallas County.
Hence, you need to keep wearing your mask. All right. Unless there's some law that says you can't wear your mask, we encourage you to consider your own health. All right.
The rate of infection in Dallas County is still considered proportionately high to the rest of the state.
Right. And if you'll go to the Alabama Department of Public Health map on the website, you'll be able to see that our county is still red, unless it changed today. Did you look today, Karen?
I did. It's no longer red.
Okay, did we?
It
we
is
go down
slightly improved, but it's still high risk.
Yeah. All right. One more question for the night.
Dr. Hendrick, can I have Max and Vax for $100, please?
All right, that's a 200-point question. Come on with it.
Your body makes these to fight off disease.
I'm gonna ask my sister-in-law or Jackie to answer that for me, please, ma'am.
All right, over team.
Wet or inside?
Yeah.
Yes. Yay.
Okay, go back to the board for just a minute. And hot off the press will now be triple value.
Ooh. Woo. Can I go?
Yeah.
Hot off the press for 400.
Oh, look at you now.
Big money. If you have been in close contact or exposed to someone who has COVID-19, You should do this and stay away from others.
Quarantine.
Put it up there.
Remember, this is Jeopardy.
What is quarantine?
Yes, what is quarantine? And I put a note in addition to that is if you are sick or test positive for COVID-19, even if you don't have symptoms, if you test positive, then you isolate.
Mhm.
So the difference is you're sick or test positive and have the virus, then you isolate away from everyone to include family in your home. But if you've been in contact and exposed and you're not symptomatic or you haven't tested positive, then you quarantine until you know that you're not going to be sick.
All right, let's look at that leaderboard. Triple value, who's going?
Dr. Hendrick, can I take hot off the press for $300?
Sure.
Number of free COVID-19 home test kits that can be ordered per household.
What is 2?
What, can I help?
Yeah,
It's actually 4.
4.
4,
What is 4?
2 per
Really?
person.
Yeah,
4
we'll
per
give you
person?
that information here in a minute.
Okay, do
Okay.
that now. Can you switch?
Let's see.
I didn't know that man.
Okay, let's go back to it, to her slide.
Can you see that?
Not yet. Share.
Okay.
It's coming.
Can you see it now?
Yes. So we want to make sure that you get a screenshot or take a picture of this information, how to get your free COVID kits. You don't have to give any kind of banking information. You can just call and they ask per household. So they should be sending you 4.
So Dr. Hendrick, if you don't get 4, I'm a post employee and there are some people only got 2. So what can they do to get the other 2?
I guess call back again.
Okay. Because I only got 2.
Call this 1-800 number because in the president's State of the Union address, he said that if you previously received 4, that starting next week, households should be able to get 4 more. So I would call this number or go to the website and just order 4 more.
But the issue is she didn't get but 2.
But
She should have gotten 4.
Dr. Hendricks, remember there are 2 tests in one box. So yes, you got 2 boxes, but there are 2 tests in one box. So you got a total of 4 tests. But
2
there's
kits per test.
right. So
Okay,
that
now
means where the 4 is coming in.
Okay, I got 1 box and then my neighbor got 1 box. So I got 1 gray bag. I didn't get 2 gray bags. So I have 4 in 1 bag or 2 in 1 bag.
It should be 4 tests in that 1 bag.
Okay.
There are 2 smaller boxes in that bag, but I would still call just to check. It won't hurt.
Okay.
Yeah, I call that number.
Also, one thing about the test is it asks you to do it twice. So you do it once and then 24 hours later you do it again so that you can check it. It has a check on itself. So
Dr. Buckner, you gave one answer to the next question. We went.
Well, you didn't have to tell them that. I'm trying to make sure they get it. I did mine. The reason I know this so well is because I got it and I did it and it worked. And I was negative and negative. So I felt very good that I was negative because I was double negative.
Okay. Now, Karen, can you take us back to the board? Because we're getting ready to wrap it up. And we're going to give them one more and either a double or a triple. And then we'll find the score. So Dr. Ford be getting ready to tell what the leaderboard is.
Can I go?
I might have to go with that's okay. I was
All
gonna
right.
go again since I missed the last one. Okay.
Come on, Mayor Lumpkin.
Okay. Let's go with that's a fat jack for $400.
All right.
Notice that her 400s now become dollars.
The COVID-19 virus can grow or live in your body for this long.
Let me ask Deborah or Jackie to answer that for me.
It's just like a mayor. See, she
What
delegate.
is 14 days?
Yes, what is up to 14 days, 2 weeks?
Dr. Hendricks.
Okay, we got time for one more question. All right, Stephanie, you were trying to get in. What you want?
Let me go hot off the press for 200.
Okay, that's triple.
COVID-19 vaccine minimum age. What's the youngest age for receiving the vaccine?
What is 5?
Yes, it's 5 years old. The government is hoping here in the next few weeks to get approval for 6 months and older, but that has not been approved yet.
So anybody 5 and older is eligible to get the vaccine unless there are some health issues that prohibit them from receiving it. All right, are you ready for, is there a clear winner or we need to keep going, Dr. Ford?
There's a clear winner.
All right, can you stop share so she can share? Let's see. The suspense is killing me. I was gonna say, if you email it to one of us in case yours won't open up too, but we'll try. Okay, it's trying to do something. Oh boy. Ooh. All right. Looks like
Yay!
man, Orville pulled it out. 6,300. All right. Man, you pull your team in here.
Yes, ma'am.
You were chipping at her heels. Look at you. I tell you. All right. Congratulations. The Orville team is our winner. Stephanie, we're going to make sure you get your prizes. And we'll make sure that everybody, because now I get a chance, you can stop share. Now I get a chance to do like Oprah. And you get a prize. And you get a prize. And you get a prize. Everybody gets a prize. So there are special prizes for the top winners, of course. And so we'll make sure that the Orville team gets their special prize, but everybody will get prizes. So make sure that we have your mail-in address if you are not in Orville. Sarah Walker, I have your mailing address. And we want to make sure the McIntosh people, we have a mailing address for that chapter. So Ms. Darlene, if you'll make sure that you text us a mailing address. And the people on the phone down here, are you a part of either one of the teams?
I tried texting those numbers.
Okay,
Can you hear me?
yes.
I tried texting those numbers that are on the screen, but it came back as invalid. So it must be a home line
So
or some
they
a
are landline.
landline. Yes, ma'am.
They may be, May, are those your phone numbers down there?
Yes, ma'am.
Okay, so those are all the residents. All those prizes will be delivered. And there's a new prize. Karen, will you show us the slide for the prizes? Oop, we're looking at the game. The newest prize was just delivered about 20 minutes ago. So we want you to see it. Karen, I can't tell whether you frozen or are you moving?
Give me 1 second. I'm not sure what happened.
Looked like you were frozen over there.
Yeah, it hung up. I'm not sure what was going on.
So in everybody's mailing package, you will receive all of the gifts listed here. And you can't, let's see. Trying to figure out how to make this show up. So Karen, you didn't get a chance to put the jar opener on there.
I did not.
Okay. Well, we have neat jar openers that arrived today. And I think you can see, ooh, I had it just right. Can you see that? This is a jar opener with the project logo on it. And they just arrived today. Everybody's been in the kitchen trying to unscrew the pickle jar and can't get it open. So we are helping you do that with a Band-Aid jar opener. So every time you use it, you'll think about the wonderful time you spent with the Dallas County Zetas doing COVID Jeopardy. I hope that you have had some fun, and now we need you to help us. Dr. Hendricks, will you open up the poll, and it should be the one that says Project Heal poll. Ladies, would you please, I think we got all ladies on tonight. Would you please take the poll for us so that we can complete our report? Okay, Dr. Hendricks, you've ended the poll.
I have not. Only 4 people have taken the poll.
Oh, okay. Ladies, would you please help us and take the poll?
I don't see the poll.
Oh, okay.
I don't see a poll either.
Let me see. Okay. Do I need to share my screen, you think?
That won't help them because they won't
Okay.
be able to answer the question.
Well, how can they see the poll? That's what they're
I
asking.
don't know the answer to that.
I think when
now, if you're on the phone, you definitely, I mean, if you're just calling in from a phone number, you won't be able to see
Denisha
it.
a co-host or make.
No,
She
I
is
am.
without the
That's
poll.
not gonna help them.
Yeah, it will, because well, maybe not.
No,
she's
it won't.
already a co-host.
Okay. Why can't they access it? That doesn't make sense.
It would have just come up. Unless, was that someone on an iPad?
Yeah.
That's, I know the iPads are a little tricky. And I'm not an Apple person. Yeah, I can't help you. I'm not an Apple. Mayor, can you see it? I think you're talking to me and you're on mute. Well, we have 8 now, and I think that's just about everyone
Okay.
because the persons who are host and co-host cannot answer.
Okay, will
Okay.
you end the poll and share? All right, of course, we are all women tonight. Let's see. And okay, 5 of the 8 of us have been vaccinated. So we hope that those of you who have not chosen to be vaccinated will think about taking that step.
Dr. Hendricks, the other 3 have been vaccinated and boosted. Keep scrolling.
Oh, okay. Can you all see the results? So everybody has been vaccinated and 3 have been vaccinated and boosted. I encourage those who have not had your booster to please go and get it. All right. Delta and Omicron are not the same. And ladies, what I want to share with you is that there is a new variant floating around out there that they're not talking about. So we want you to continue to be careful. You can still get COVID-19 even though you have gotten your COVID vaccination. And yes, that is true. You can still, because each variant seems to find a way to break through. And the vaccinations were designed for Delta. And then here comes Omicron. And if you think about your vaccination, as the COVID vaccination, very much like the flu, every year they have to try to guess ahead of time what strand of flu we might be experiencing in order to get the flu vaccine done. And that's pretty much what our researchers are doing now. All children and adults can get a COVID vaccine. Now, what is the age that everybody, when? What's the age?
5 and up.
5 and up, 5 and up, right. COVID-19 affects fertility. And that's not true, so don't let anybody tell y'all that. Getting a COVID-19 vaccine can make you magnetic. No, that's not true. So you hear a lot of that stuff on TV. That's not true. Tell your friends and family that's not true. COVID-19 vaccines will affect my DNA. That's not true. That is not true. And when we look at our age range tonight, it's almost an even split. Wonderful, wonderful. And most of you received the email invitation or the organization invited you. And so we thank you for joining in tonight. I guess, Darlene, since we know you represent the Macintosh group, would you like to say anything?
I just like to say I had really enjoyed. I had a good time. I never seen nothing like this before. I really enjoyed myself.
But thank you for joining us tonight. Tell your chapter you held them up tonight.
I will tell. I was waiting on them. But I will tell some so they had to work late.
Okay. Wanda Walker is a member of Zeta Phi Beta from Florida. Wanda, would you like to say anything as we begin to wrap up?
Hey, I'm sorry I wasn't able to participate, but having a sick child get well is no fun. They get too much energy being well. When they're down, it's okay, but boy, But I had a real good time. I learned a lot, and I really appreciate that. It's just in the state of Florida, I couldn't get any team members. Seeing that the other Dr. Hendricks is on, she has a class tonight that a lot of my chapter members are involved in. Plus, the state of Florida has some other meetings that they do on Thursday nights, which I didn't know about until I invited them to come participate. Next year, whatever's going on Thursday nights, and we have anything similar, they're gonna have to cancel and come to this and help me win. Okay, but congratulations to everybody. I did enjoy it. It was nice meeting with you, and give yourselves a hand for everything and keeping abreast. That was really good. Thank you.
Thank you. Miss Stephanie, you have been with us the whole time.
Yes, ma'am.
Would you like to say anything as we begin to close?
I haven't really enjoyed myself. I thank my sister for inviting me.
Well, listen, you just got on in there. You gave Orville a run for the money.
Yes, I was trying to.
Mayor Lumpkin, we're going to give you the final words because it's all about Orville.
I would just like to say, just to Dr. Hendrick, I promise you, I hate to see it close. I wish we could have go 4 more times. I have truly enjoyed myself. I had a lot of people from Orville got on board tonight, and this has truly been a learning experience for me. I can't wait for next year, Dr. Hendrick. Do it all over again.
We hope we don't have to wait till next year to have another community initiative in your community. And so we're going to be talking with you to see how the Dallas County Zetas can continue to work with your community. We are still working with, of course, your Salem Elementary School because we adopted them for 2 years, and our 2 years are about to be up. So we're going to have a conversation to see if maybe we can adopt the high school or so we can stay over on that side of the Dallas County. But listen, that we are here for you. As you see, we are here. And so anytime the Gamma Alpha Zeta chapter, affectionately known as the Dallas County Zetas, can be of service to your community, please call on us. You have Miss McGee, Dr. Buckner, Dr. Ford, Miss Bailey, Dr. Denisha Hendricks, and myself here to say thank you for accepting our request to serve the Orville community in this initiative. You are all duly designated as healers, health equity ambassador leaders. Leaders, you are a healer. Go forth and share your knowledge. Any final comments from any of the chapter members? All right, ladies, thank you for sharing your evening with us. Be safe. We will get your look next week in the mail because Dr. Ford's gonna be working on mailing those things out. And Mayor Lumpkin, we're gonna make another delivery to the office. So all Orville residents, go see the mayor.
Thank you.
Until next time, be safe.
Next time.
Bye-bye. Continue to
Bye-bye.
wear your mask.
Good night.
Thank you all.